Pseudomonas. Pseudomonas, again, a big family. Aeruginosa. So let's go to the basic one that cause problem. Look very colorful, beautiful, but they are not that playful. So if you look at the genus, like a bigger group, Pseudomonas as a group, what you saw was that heterogeneous collection, non-fermentative bacteria. Again, for the first 10 lectures, I'm very keen of asking and knowing whether you know how does bacteria ferment, whether it needs to ferment or not. So fermentation is a serious issue, not because of basically this class, but basically bacteria used in fermentation in industrial microbiology. So their capability to ferment sugar or not to ferment sugar, and what sugar do they ferment, and what is the byproduct is an important concept for you. Non-fermentative, that were grouped together, and they are Pseudomonas. There are more than 200 species. You don't have to worry of them all. Pseudomonas aeruginosa is the one that is important for human disease, and that we will discuss. They are found in soil, decaying matter, vegetation, and water. And also keep in mind that some of these bacteria are good for the environment ecosystem, but because we throw away all the junk garbage and all that decaying matter, they chew it up for us, and they better make a good use of that. The problem with Pseudomonas is that hospital environment. So that's why, especially if you go to the hospital in their AC system, reservoirs, moist reservoirs, even in their kitchen, and sometimes we do want to take flowers to the patients, and many times hospital itself provide you that ability, but being a medical person, that may not be a good thing to take to the patient, especially cut flowers, because you are just transporting bacteria because they're not sterile. You don't want to autoclave them or wash them or clean them. So there's always something going on. And then again, hospital cleanliness, if you're in respiratory therapy, when they put those incubators on you, the ventilators on you, they had to be clean. I mean, just like, it's like a faith kind of thing. So you are sitting over here in this lecture hall, hopefully have a full faith that the whole AC system is going to be good, right? There are proper filters and so on and so forth. Because you pretty much spend like 6-7 hours over here in a very contained environment. So imagine if your immune system was compromised in the hospital. So if all those 10 rooms are linked together by a central AC system and there's suction there, so what will happen to the whole hospital environment? They really have to regulate that. They have to take care of it very, very professional way. Okay, so Pseudomonas is one of those bacteria that the hospital people also worry. And then again, they basically, one of the rules I'll just share with you, especially for metabolism. So those of you who are preparing for the chapter, probably 2 or 3 for tomorrow's exam, is that when we say simple growth requirement and nutritional versatility, so this means that we can grow them on anything. So this also means that they can cause problems. So any bacteria that has fastidious nutritional complex, so of course, before it grows, it has to acquire that metabolic things to grow. So that's good for us, bad for bacteria. But again, those bacteria may have problems. So this one particularly are capable of using many organic compounds as a source of carbon and nitrogen, because like human beings, they use carbons and nitrogen. And the problem now comes that if they are that simple in growth requirement, they can even grow in distilled water. Right? So they can grow any. So even if you have a beautiful AC system, is it water going in distilled water, you can contaminate them with Pseudomonas because they have simple nutritional requirement. Then they also have some structural factors, enzyme, and toxins. Because bacteria have, it's just like animals. Some of the animals have hooves, some of the animals have teeth, and they have claws, something extra for them to survive in the jungle. which others may not survive. So bacteria like that, they have those kind of surviving mechanisms where they have that power, that kind of an ability in terms of inflicting damage to the threat and also protecting themselves at the same time. That's why they have survived over time. And they may have virulence and resistance to most commonly used antibiotics. That's why that's genetic chapter I would advise you to better understand very, very carefully what conjugation is. And there are two types of conjugations, where one is an F positive going to an F negative one, and when it is transmission by conjugation of the plasmid. The other one is when you have high frequency recombination, where the plasmid, which has that particular gene, doesn't need to transfer by plasmid, it needs to transfer by encoding into the chromosome. So two types of conjugation, make sure you understand that. Transduction, transformation. So because the problem is, that's why we have a workshop as well, every bacteria is becoming kind of resistant to antibiotics. We are running out of time. That's why we have to come up with new antibiotics. We have to come up with all those immunological drugs that will help fighting all those virulence factors, adhesion, toxin, IL-8, so on and so forth. Otherwise, imagine a situation where you have infection and there's no antibiotics because bacteria took time to develop their arsenal, but now this is their time. They are coming back again for the human race with a challenge of antibiotic resistance. We want to know how do bacteria pass this information in terms of genetic transfer of particular things. Pseudomonas, singly and in pairs, the gram staining. If you look at the sputum, for example, in a cystic fibrosis patient, because they have thick secretions. So when you have thick secretions, cystic fibrosis patient, if you inhale a Pseudomonas, so this is going to get clogged in your sputum. That's why asthmatic will have infection, because the problem with asthma is they can breathe in normally, but they cannot breathe out normally, right? So anything that goes into you is going to stay over here. So you can see gram staining of Pseudomonas surrounded by the mucoid capsule. So they already have a mucoid capsule. It's sticky. It's going to stay over there. And then again, it's going to be anti-phagocytic as well. So these are some of the virulence factors. And now I think you must acknowledge that why do we go for virulence factor? Because we need to develop drugs. The more the virulent factors a bacteria has, the more choices we have in terms of drug development. Okay? I mean, no, it's hard for you to remember, but again, it's good for you when you're going to apply for a job in R&D to work on all those drugs. Skin diseases, very common, swimming and hard duct folliculitis. Typical Pseudomonas, very typical for public swimming pools and so on and so forth. And the worst form of skin disease is especially a very serious thing, that infection of the burn wounds. So if you have anywhere from 10 to 30, 40, 50% burns, Pseudomonas basically will come and cause problem. That's a major problem that we normally see in burn patient. They have to do something to protect this burn patient from infection from Pseudomonas. Very common question asked. This is one of the bacteria that goes like, peering. Expect some question for the pairing as well. So you'll have select the best combination or pair. So you have a Pseudomonas aeruginosa on one side and the burn on the other side. So that's what pairing means in terms of understanding the effect. Folliculitis we already discussed. Again, is from your book. The worst form that we are seeing these days is chronic patient bedridden, bed sore. Bed sore is a serious, serious problem. You wonder many times diabetic patients end up getting amputation, foot, hand, and the worst nursing care, the most difficult nursing care, if you're obese, if you're overweight, you cannot turn around and you have bed sores, you are in problem. This is how bed sores look like. Getting infected with Pseudomonas, antibiotics would not work. Creams would not work. That's very debilitating for the patient, very challenging for the health providers, and very, very challenging for us to come up with some treatment that we may see here. Now, another important thing for Pseudomonas is that they tend to produce pigments. So that's another thing. Industrial microbiology, that all those fluorescent markers or whatever you use. So where is this pigment coming from? So some of these Pseudomonas are providing that pigment for you. So they grow these bacteria, and they can then have these kind of blue and yellow and different colors of compounds that come as a byproduct of their growth, and then use them in industry. So that's a industrial microbiological use of some of the bacteria. Okay, I think pretty much the same information. I don't want to go what do we mean by aerobic respiration. Cytochrome oxidase is an important, again, is a very important test that we normally do. And cytochrome oxidase, if you remember your electron chain transport for oxygen, especially at the mitochondria, bacteria do not have a mitochondria, so their electron transport chain happens on their cell membrane. They are mucoid, we talk about that. They have diffusible pigments. I showed you the color, but again, any color, any spectrum of color are there. If you look at, if you want to have a aggregate or a memorizing slide from your book, especially for Pseudomonas aeruginosa, you can see over here, obligate aerobes, glucose oxidizer. As I said, that I want you to know that what is a particular sugar that these particular bacteria either attach to. Sometimes they attach to a sugar moiety. They have a receptor. If you look at that table where this virulence has adherence, you'll notice that there are some of the sugars selectively attaching to one particular bacteria. Some of the fibronectin binding protein attaching to some of the particles. So that is very specific kind of information that is for your knowledge. It has multiple virulent factor. We talk adhesions, secreted toxins. Again, I think maybe it's the last time I'm going to say that. Make sure you understand the difference between exotoxin and endotoxin. What are the exotoxins? They are secreted proteins. They are not attached to they are not those enzymes. They are not those adhesion proteins like MNF proteins. They are attached. They are secreted. So this is an important concept you have to have. Secreted toxin enzyme, exotoxin A, pyosine, and so on and so forth. And then again, many times, this particular bacteria, aeruginosa, has antimicrobial resistance. The diseases it causes is, again, because it's in the AC system. I just told you it's an AC system. So most likely respiratory tract, urinary tract, and so on and so forth. And then when anything that goes into blood, it's called bacteremia. And any bacteria that goes into the blood may also cause endocarditis. And I would want you to make sure you understand the difference between endocarditis, myocarditis. Because endo means innermost, myo is the muscle part. Okay? And pericarditis is the outer covering of the heart. How does it produce disease? If you know the virulence factor, if you have done your part in pathogenesis of bacteria, how does bacteria cause damage, you pretty much know that what are these important for. One thing that comes over and over again, and I don't know, many of you may not have read it when we were talking physiology about the secretory systems that we have in terms of cellular secretory system. In this case, the delivery system that Pseudomonas uses, type 3 secretory system, is particularly for injecting toxin into the host cell. If you pay attention to some of the pictures that I have, pretty much in all the slides, I show a cell, then I show this receptor on the top, fibronectin binding protein, and then AB toxin comes and attaches to it. It gets endocytosed. One part is broken up, right? And the other part goes into that. So that's like you have a syringe, you put a toxin over here and inject it into the cell. So these are different type of secretory system that we have where you inject toxin into the host cell, type 3 secretion system. And then again, we are still working on the virulence factor and find out what exactly is happening. They're always work in progress, so to speak. We discussed earlier that they are present everywhere, especially in hospital. I gave you an example. I'm not discouraging by any means that you shouldn't take flowers to your patient. Of course, you should do that. But again, if you see in microbiological aspect that anything that is out there in nature, especially for this particular bacteria, is mechanical ventilation and dialysis equipment. And it's there all the time. They can transiently colonize your system. This means for a short time, and then while you're hospitalized, and once you're over. So that's another concept I want you to know, that your normal flora within reasonable limit is normal. But if a person having a normal flora goes to the hospital flora, so he transiently picks up hospital flora, and there's a little bit of a change in his normal flora. This is also, if you go to the left of my slides, it say the normal flora is in continual flux. So this means then you change the food, you change the company, you change any environment ecosystem, within reasonable limits your normal flora can change. That's why the whole concept of using probiotics, that's basically they want you to have good set of healthy bacteria. I'm not going to go in detail what's right or wrong, but still that's a concept there. They want your gastrointestinal tract to, and again, very interestingly, in third world countries, many times they think that people once in a while or once in a year is in some kind of, I don't know which kind of medicine that is, they would want you to, like bowel cleansing. So they'll say, take this bowel cleansing, get rid of, because the problem you have is from bacteria, which is true. But they want you to get rid of all this bacteria over there for a short time, and then according to their concept, you have healthy set of bacteria, right? So remember that the whole idea is that we do have normal flora within normal time. But for me, as a microbiology immunology person, I'm more interested in teaching your immune system what is your norm, right? What is your norm? So your immune system gets used to it, and they pretty much know what's going on, and they are ready, because if they are not, they may respond to it out of like an inadvertent response, overzealous response, and that sometimes happens, the thing, as the etiology of chronic bowel diseases, like inflammatory bowel disease, Crohn's disease, allergies, and so on and so forth. But I want you to really understand the whole concept behind it. What is normal, what is not normal, what are the factors affecting it, and so on and so forth. And then again, in this case, transient colonization, difference between colonization and disease, difference between nasal carrier. I gave an example for typhoid Mary. She's working as a cook, and she has typhi, Salmonella typhi in her system, especially in her gallbladder. They found it after post-mortem examination. Right? So things are there that needs to be investigated. Simple growth requirement can grow anywhere, but it has beta hemolysis, and if you remember, we discussed that in detail, beta and alpha hemolysis, especially for streptococci group A and B, which have a beta hemolysis, complete hemolysis of the red blood cells. So if you grow them on the plate, you see a clear zone, a halo around those bacteria, produce different pigments. Simple biochemical tests are done, oxidase reaction, and as I said earlier, I will repeat again, catalase, oxidase, all these are important for you to know whether a bacteria is positive or negative. Clinical summary, we already discussed. I told you it causes respiratory infection. It can cause skin infection. I gave you the folliculitis or swimmers, they call it swimmer's rash. So swimmer's rash for public pools and so on and so forth. Urinary tract infection, if you have indwelling urinary catheters, you can have that. Ear infection is called swimmer's ear as well, because water goes into your ear. Eye infections, bacteremia will be something very nasty when the bacteria goes into your system. So these basically, my take on that is that if you understand the pathogenesis and virulence, and you know what kind of armory, what kind of weaponry, what kind of factors the bacteria is coming up with in terms of causing virulence or damage, you can correlate that to disease. Portal of entry of bacteria is important. If you remember me talking about that, some bacteria want to cling to your respiratory tract because they have receptors for that. Some of the bacteria want to cling to your urinary tract. Some of the bacteria want to cling to the vaginal epithelium because that is a perfect fit for them in terms of the receptor they carry, in terms of adhesion molecules that they carry, right? So that's another important concept that I think you should understand and pay attention to the pathogenesis of bacterial pathogenesis chapter. That will help you for the exam as well. Okay. Treatment, prevention, control, combined use, different set of antibiotics depending upon which is a beta-lactam sensitive or not. We have to make sure hospital infection is under control, typical sterile medical equipment, so on and so forth. So when we say nosocomial infection, for example, so nosocomial infection, Pseudomonas will come over there because people can acquire from the hospital if the hospital is not kept. So they always do these kind of random tests, public health laboratories, to check and make sure that the hospitals have to stand at a very higher level of disinfection, higher level of OSHA requirements, and so on and so forth, because it's going to cause damage to the patient. And again, conclusively, there are summary slides available, flashcards available. Just to give you an example, over here you can see trigger words, nosocomial infection, I just told you. Cystic fibrosis, I gave you an example that because the respiratory secretions are clogged inside and because of chloride deficiency, so they got blocked those alveoli, and if Pseudomonas go over there, it will stick. It already has a polysaccharide capsule. And then again, many other important things are there, and I mean, you can obviously download these from the podcast as well and help yourself for that. Okay? All right, thank you.